All right, and welcome, one and all. I am Ben Levy, be your host today for this special presentation regarding Medicare. Those that did get the invitation, you join in with us today. So we have a few more minutes as we like to start on time. And we're going to be talking about Medicare today. So get your pen and paper, take some notes. I'm going to be sharing with you some great information. And of course, we'll be having questions available as well. So do come on in. We're going to start promptly as we do respect everyone's time. Just give some people a chance to get logged in, with technology. And we will be right back in the next 2 minutes. 2 minutes to the start of our educational seminar on today's date, October 9th, the year 2024, talking everything Medicare. Be right back. Okay. And we are here 1 minute after. Again, getting ready to start. Just want to make another announcement for those that are looking to join us that we are indeed live. Just bear with me one moment and you will see that. Okay. See the Zoom. All right, everyone. As I said, we are definitely respectful for everyone's time. So we are going to jump right in here as this is going to be recorded. And those that do come along will be able to see and join everything. All right. Right there. It can be seen here. Resume and share. Okay. Here. All right, so once again, um, welcome one and all to this live presentation for Medicare. I am your host, again, Rob Benjamin Levy, on this date, October the 9th, 2024. If you do have any questions, do raise your hand or leave it in the chat and we will discuss it. So let's begin here. We're talking about Medicare, explaining the basics of it, understand my role as we're entering into this new season. The Medicare enrollment starts in just a few days here. It's actually 6 days on October 15th. I'm happy to be a licensed representative, independent agent here. I am licensed and appointed with all the major carriers, and also including some of the regional carriers, which we'll get more into details about that. As an agent, the carriers pay me directly. The premiums do not change working with me. And I assist you in helping find the right plan, first and foremost, and the right carrier for you, which there are differences between them. And so I'm fully trained and licensed to review that. On an annual basis, I would be with you just to review your plan, because they're always making changes to the plans on a daily and a yearly basis to make sure you're not missing out anything and improve your services. So what is Medicare? Taking notes. The basic understanding of Medicare is consisted of several different parts. The most important, you become it's a Medicare, is what they call Parts A and Parts B. When you turn 65 or thereafter, your birthday, you can enroll in Medicare. Medicare is a federal insurance program entitled, once you reach that age, to health coverage, right? So typically most people will sign up at least 3 months before their 61st birthday or anytime thereafter. Coverage will begin on the first day of the month in which they turn 65. Your Medicare will begin. If you have been working in the United States for over 40 quarters, and you are entitled also to Social Security, you will automatically be enrolled in Medicare, Parts A and Parts B. And we'll get into more details of what that is. But in short, Part A allows you to go to hospitals and get care if emergencies happen. You can go to the local hospitals. And Part B allows you to see your local doctors. So you need those at a bare minimum to start your coverage. There's a cost associated with each of them. We'll get into that in a little more details. But just to note, for Part B, the premiums this year is $174.70, which, if again, you are enrolled in Social Security, will be taken directly from your Social Security check. So again, when can you enroll in your Part A and Part B? All right. If you're not taking it out of your Social Security, you can also sign up and have it taken from your checking account. If you don't get Social Security, you're also able to do that by going to your local Social Security office and they will help you enroll. And then Part B premium will be billed to you on a quarterly basis. But most people do it through their Social Securities. All right. Working with Medicare. Yes, some people do not have to enroll in. Like I said, if you have a valid waiver, if you've been actively working at an employer and you recently retired, it will automatically be enrolled and flows right onto that. You must, though, have parts A and B as a bare minimum, what they call original Medicare. You must have both. Typically, those that are currently working at an employer, they do not have a Part B enrollment because they're covered through their employer. But once you're no longer with your employer, you will need to be enrolled in Part B. All right. And for smaller companies, they usually have an insurance program for a group of 20 or more in their company and allows them to not have the Part B. Or if you recently, again, were let go from a company, then you also are entitled to COBRA insurance, which is also a health insurance. Again, that it gives you access to the health system. Or if you are in the military, you are a veteran, you also have access to healthcare through the military or the Veteran Association. Negative stuff. So once you originally become eligible, you are encouraged, it's not mandatory, but encouraged to sign up for Part B. If you choose not to, and you do not have a valid reason, just be aware there is a penalty of 10% of your Part B premium for each year which you did not enroll in that program. All right. There's exceptions, of course, again, as you were in the military, if you were in COBRA or you were still actively employed, then you would not be subject to any of those penalties. Now, there are certain adjustments that are made for those based on your income. If you make more than average, then they will adjust the amount. That's based off of a 2-year rolling period. They'll look back, see what your income level is. If you're married, they'll look at it combined and then make adjustments if necessary. If you don't agree, you also have the ability to appeal any decisions that you're not agreeing with. Again, Part D penalty, if you do not have a Part D. So you have a B, this allows you to go see doctors. Part D allows you to go and get medical, your prescriptions, drugs. D stands for the drugs. So again, it's not required, but encouraged. If you do not get a prescription drug plan or Part D, when you first become eligible, there is a penalty, a 1% per month penalty based on the national benchmark premium. And you will pay that penalty once you finally do enroll in a prescription drug plan. Keep that in mind. Okay, so let's go over again in more detail now, the different parts. Part A of Medicare, what is it? That allows you to go to hospitals, all right? There is no premium for Part A if you've, again, been working and you built up enough credits. For most, there is no premium for your Part B. What does it cover? It covers your inpatient stays at a hospital. It also covers skilled nursing. It also covers inpatient rehab and hospice. Okay. Part A, original Medicare, covers some of your home health care. And for 2024, you are responsible for a deductible of $1,632. Part B of Medicare covers your physicians to go see doctors outside of the hospital. These are outpatient services. It covers certain home health services. It also covers your durable medical equipment that you may have a need for. And there is a premium. I mentioned again, everybody pays the Part B premium. The premium this year is $174.70. And also this year, there is a deductible of $240. Aside from that, you are also responsible for 20% of any incurred expenses. The rest of the 80% original Medicare will cover that. Now, in addition to parts A and B, right, you have other options, which again is the part D for prescriptions. If you are taking medication, initially you will definitely sign up. For those that are not taking medication, you may not want to, but is encouraged to, and still sign up for part D to cover your prescriptions, right? And also note, they have made changes to Medicare to help with your cost of medication, which could be expensive. They have maxed out the cap. The most you can spend out of pocket for your medication in the year 2025 is $2,000, which is a great benefit for those who are taking a lot of medication. All right, now that we've covered that basics, let's go a little further. Once you have parts A and part B, which is called original Medicare, and you may have also had a part D to cover your prescriptions, you still have two other options. Mentioning again, there's 20% of the cost with original Medicare that you would still be responsible for. So there's a gap. So you have two options at this point. If you want to be fully protected and cover as much as possible, there's an option called Medigap to fill the gap between where Medicare stops and what you're responsible for. These are called Medicare supplement plans, or Medigap for short, which you have to buy. They're not free. You would have to buy in addition to original Medicare. All right. And also, again, your Part D, with your prescriptions, was also separate. So you have the option, which many take the option, if you can afford it, to purchase a Medicare supplement plan or a Medigap. All right. For those who have a limited income or tight budgets, they may also have the option to purchase, again, what they call an Advantage plan. Now, there's some big differences between a supplement and an Advantage, right? So there's the old saying, you get what you pay for. So both are private insurance companies that you're purchasing the plans from, all right? But one, being the supplement plan, works with original Medicare, all right? Meaning you can go to any doctor that accepts Medicare worldwide, which is a huge advantage. Whereas Advantage plans, right, this replaces original Medicare. So they have their own separate network of hospitals and doctors that you must use. All right, that's how they're able to control the cost. So you are limited in the choices, if you will, of hospitals and doctors you can go to by going with an Advantage plan. So that can be, a huge, disadvantage There's some, but depending on the cost, you may have, that's maybe your best option. So again, you will receive in the mail, once you become 65 and enrolled, you will get a red, white, and blue card from Medicare stating that you are enrolled, and it will tell you exactly the month and the year which you are eligible for parts A and B, as you can see on the screen here. Very important. And then once you have your Medicare card, then you have the option to either go with option one, which is to purchase a supplement plan or a Medigap, or option two, to purchase an Advantage plan, or you may hear the term a C plan. Okay. Your choices. In addition, with the part option one, a supplement plan does not cover your prescription. So you also need to purchase a prescription drug plan if you decide to choose the supplement route. All right, so there's definitely a lot more cost involved by going the Medicare supplement route. And so keep that definitely in mind. But note, the good part is that the advantage is the plans are standardized. So once you pick it, the supplement plan, it can be used worldwide. There's no networks you have to worry about. You can go to any doctor or any hospital that accepts Medicare, which is pretty much 99% of all hospitals and doctors out there. You have the flexibility, again, to go and pick and choose. You don't have what's called a primary care doctor. You can pick and choose. There's no prior authorizations required. And you have a lot of flexibility there. So you pretty much manage your own care. But you do have to also purchase a prescription drug plan in addition to what you're already paying for your medical supplement plan. Right? And there are times when certain doctors do not take Medicare. In those situations, again, you can go to them, but the cost would be completely on you. But that's rare. Most doctors do accept Medicare, and everything's hot. With the supplement plan, also keep in mind, which is a disadvantage, it does not cover your dental work, which could be huge. Dental coverage is not included with the supplement plan. Neither is vision and other programs like gym memberships and so forth, which, again, when compared to the Advantage plan we're going to talk about, could be a big difference. So depending on your needs, just know upfront what you're getting and what you're not getting. Right. Option two, again, going for Advantage plans. There's a lot of advantages there. Cost being the number one, right? With a supplement plan, when you initially turn 65, the average cost for a supplement plan is $100 per month. Versus an Advantage plan, they're pretty much as low as $0 per month. So as you can see, it's very attractive from that perspective. From a cost perspective, Advantage plans, zero premiums, it's a win-win. Now there's a catch. What are the catches? The restrictions. Again, you cannot go to any hospital or any doctor you want. You have to stay within the plan limits and the agreements they make with hospitals and doctors. So that's one of the catches involved. The good news is with the Advantage plans, in a lot of the cases, they also include the drug coverage or Part D. So there's no additional charge. Again, it's saving you a lot of money. You don't have to buy a separate Part D plan, and your A and B is included. So it's a lot of advantages there. The drawback is, again, limiting the hospitals and doctors you can see. So as long as you're comfortable with that, your doctors are covered, it's a win-win. You have a lot of specialists and different doctors who are not in so-called network, then those plans don't work for you. So it's very important to make sure all your doctors accept the plan if you do go the Advantage route before signing up with them. And again, also with the advantages, they throw in those other benefits such as dental coverage, vision coverage, and something called over-the-counter allowance when you go to the pharmacy. So a lot of little extra perks that you don't get with option one. What are the negatives? Again, with these plans, because they're privately owned and they're trying to manage the cost, all the plans are different. So you got to really look at the details, making sure, number one, all your doctors are covered in that plan before signing up. Um, you may need prior authorization to go see certain doctors. There's managed care involved, an HMO. We'll get into that, where you assign a primary doctor who then refers you out to other doctors based on just services to help you. So there are some limitations there in terms of, again, which doctors you can go to, what hospitals you can go to. There are some co-payments involved. To go see a doctor may cost you $10. Depends. See a specialist, $40. So there are cost sharing involved. So it's not totally free, zero premiums, but you're not free from co-payments and co-insurance. So keep that in mind as you're comparing the different Advantage plans. Find the one that works best for you. Mm-hmm. And also with that, let's see here. Again, depends on your situation. What are you comfortable with? The number of doctors, your health status makes a big difference. And keep that all in mind when you're selecting your different plans, right? So now, when can you enroll in these plans? As I mentioned, we're out in the most busiest part of the year in the season with Medicare, which starts October 15th and it runs all the way through December 7th. This is your chance to sign up, make changes to your plans, enroll in new plans, anything you want to do. Now is the time when the annual, let's go once a year, annual enrollment period, you can make all these changes. All right. But pretty much no questions asked. And so that all starts October 15th through December 7th for the next year, 2025. So all the changes you make will start on January 1st of 2025. Right. Following the AEP period, if you're writing this down, is what they call the OEP, which starts in January 1st through March 31st. So the first quarter, there's a second chance if something happened, you start the plan and you know what, you want to make a change. So Medicare does allow you to make another change in January to go from one Advantage plan to another Advantage plan. Or you can go from an Advantage plan back to original Medicare and sign up with the supplement plan and a drug plan if you choose to do that. So you do have sort of two chances, one through AEP, which starts October 15th, and then the other one's OEP that starts January 1st. All right. And of course, you can sign up anytime during the year. If you just turning 65, you don't have to wait to those periods, but that's only when you first turn 65 can you sign up. And also with that, if you go in the supplement route, there is no underwriting. There's no, it's guaranteed pretty much. If you want it, you can get it no matter what your health status is, which is huge when you first turn 65. After that, when you turn 66, you may have to do an underwriting to qualify for that plan. So then consider that very carefully when you first turn 65. All right. Outside of that, there are special conditions where you may need to change your plan. If you move from one state to another and your plan is not covered, there's a they call special election, SEP, that you can change your plan during that time. If you have Medicaid and getting special help, there's also a chance where you can change if your Medicaid status changes, you can also switch your plan. Or if you're working and you know, retire, you can also change whenever the period of time of the year that is allows you to do that. Outside of the special election periods, like a hurricane or a disaster, you can also change in those situations. Uh, Medicare allows you to change your plan. With that, as your independent agent advisor, you can always call me during the year. If you have any questions, problems with your plans, reach out to me. But definitely expect a call in October just to review your plan and see if there's any changes that may affect you. There may be better plans available. So we would just review. You don't need to change, but it's always good to look because they say you don't know what you don't know. So we just review to make sure and see you still have the best plan. So with that, short and sweet, uh, those are just the basics of Medicare. Hopefully we answered a lot of your questions there. If you want further detail, more personalized analysis, we can set up a meeting. We'll go over the details for your situation. Make sure we have the best carriers for you. This again, making sure that all your medications are covered, and there's no big changes in the cost, the prices of your medication. Make sure your doctors are still on the list, they haven't left the plans, and those types of things. We would definitely do that. So let me know, email me, make a phone call. My phone number again is area code 610-771-1043. That's 610-771-1043. Or you can email me at benlevy18@gmail.com. And with that, again, I want to thank you for your attention. Don't see any questions in the chat. So that's a good sign, meaning that I did a pretty good job here. And so we will see you the next time. Thank you for your time today and enjoy the rest of your day. Take care.